Hello, my name is Michael Feldman. I'm a psychiatry PA, and today we're going to have a conversation with Doctor of Psychology, Dr. Irina Volynsky. She specializes in child and adult psychology.
Hello.
There are many questions that are being asked by parents of children that underwent acute traumatic events, and they're asking how they can help their child to recover from these events.
Right. So I would divide the role that the parents or the loved ones can play in a child's life at the moment into two different categories. One is to provide the child with a sense of safety and security. And young children who are younger than, I would say, 6 or 7 years of age, they derive their main sense of safety and security through being in the same room with an adult, quite frequently actually being very close, physically touching an adult that they trust. This is how they make sure that they are safe. This is what makes them feel safe. So one component of providing the healing experience for the child would be to spend as much time as it is humanly possible in the same room with the child. Sometimes the children would regress to trying to sleep in the same room or in the same bed with you, and if it is at all possible, please let them do it. They can come out in the floor by your bed and be in your bed, but this is how they feel safe. And the second component, what they can do as adults, they can facilitate play, because this is how children process pains, this is how children process trauma. Adults talk, children play, and this is what allows them to regain a sense of control of their lives. Usually, trauma feels as an ultimate sense of loss of control. And the way out of it is to regain a sense of control. And children, through play, through creating different play scenarios, they arrive to a place where they feel they are in control once again.
So when child plays, many times people and children that underwent the traumatic event would have a scenario that is traumatizing by itself. It can be very aggressive, very painful, very scary. How should the adult, the caregivers, react when they see such a place, such a scenario?
Within the play.
Within play.
Right, okay. So the difficulty in the current situation is such that the majority of adults who are with the children, they had undergone the same or more acute trauma. Because when a child plays within a play therapy format with the play therapist, quite frequently that adult did not experience the exact same trauma. But when it comes to children and primary caregivers, they had probably gone through a very similar experience. So I can imagine that as a play facilitator, that particular adult, caregiver, or a parent may have very hard time bearing witness when those scary, horrible, traumatizing scenarios unfold within the child play. And what can we do as adults? We can sit there, we can breathe through this process. If the child comes to us physically seeking that warmth and that safety of physical touch, we would give it. If bearing witness to the process of unfolding this traumatic scenario within the child play becomes very difficult to bear, you could look around, look away, look around, name, let's say, 3 yellow objects, 3 green objects in the room. This is how you anchor yourself to the current reality. Keep breathing, and then keep playing with the child if you can, of course. Ask the child questions within the scenario. Oh, what's happening there? How is this one feeling? What's gonna happen next? But your questions have to be neutral, and they cannot be particularly leading in any shape or form. If at all possible, try not to switch the child's attention to anything else. Try not to curtail the scenario. Try not to bring the child to to the place of safety in an artificial manner. The child has to grapple through the process of finding solace, finding peace, finding safety within the scenario. And you should be just one step behind the child. Do not lead, follow the child, fulfill the role that the child assigns to you. Be it, now mommy, you're hiding under the bed while I'm fighting bad guys. So then yes, hide under the bed. Be it a literal bed in a room or like a tiny bed within a dollhouse. Listen to what your child wants from you, and allow the child to be the director of that unfolding film. This is how they regain their sense of control, and this is how they process their trauma.
Children many times would play through the same type of scenario again and again and again. And what should we expect over time to change in these scenarios and the plays the child plays?
This is absolutely correct. Just like, for example, as adults, when we go see a psychologist, we tend to discuss the same matter, frankly, and we can talk about the same traumatic experience, but just from different angles, from different perspectives, kind of through different lenses. By the same token, the child has to play out the same scenario in order to stop experiencing pain or fear or any other negative emotions they had experienced during the process of living through the trauma. So you actually should expect the scenario will not change for many times. It could be 3, 5, 12 times that the child will play that same plot through exact same steps. And all of a sudden, on, I don't know, number 7 or number 13, you will see that there will be a switch. The child will develop the scenario in a slightly different manner. There would be, maybe the ambulance gonna come into the scene, or maybe there will be a magical, I don't know, some magical creature who will fly into the scene and lift everyone up and bring them to safety. But there will be a change in scenario eventually, as long as the child introduced the change in scenario and not you. As long as that happened, it allows the child to be in control, to experience a sense of positive change within, I have to say this is therapeutic work, so within the therapeutic frame, and again, to get to the sense of healing and safety.
So let's summarize this. First, your child needs physical contact. If the child asks for physical contact, let it have it. Let the child have physical contact, hug the child, let the child grab your legs, knees. If the child wants to come and sleep with you in the bed, let them do it. The second thing, children recover from traumas through play. So even if the scenarios are very scary, very painful, let them play the scenarios and do not lead the game. Let yourself be the led person and the child will be the leader there. And it will take many times, many repetitions of the same scenario until they begin to change. And slowly it will help your child feel the security in the current situation, in their current reality, and eventually it will help to slowly recover from the acute traumatic event they went through. Thank you very much.
Thank you.